I shall start it now officially.
Yeah, sure.
Namaste, Kurum Jari. Good morning to everyone present here. On behalf of the organizing team, myself, Dr. Madhurani, Assistant Professor at Botany, the Deshbandhu College, I extend a warm welcome to our respected invited speaker for today's webinar, Dr. Samiksha Singh Ma'am, Additional Professor at Indian Institute of Public Health, Delhi. Our respected Principal, Deshbandhu College, Professor Rajiv Agarwal Sir, respected Principal, Pettigrew College, Shri Surai Shank Sir, our respected Vice Principal, Deshbandhu College, Professor Kamal Kumar Gupta Sir, our Coordinator of IQAC at Deshbandhu College, Dr. Aditya Saxena, conveners for V2S from Deshbandhu College, Dr. Moses and Dr. Parul Singh, conveners for Vidhya Vistar scheme from Pettigrew College, Shri Kapung Singh and Dr. Gaikwangklung Gaumei, conveners of this event, Dr. Anand Kumar and Dr. Aparna Shekhar, esteemed faculty members, and our dear student participants joining us today from Deshbandhu College, Pettigrew College, and various other colleges and institutes. Importance of health has always been well known. The practice of public health has been dynamic in India and has witnessed many hurdles in its attempt to affect the lives of our people. Since independence, we have witnessed major public health problems in the form of diseases like malaria, tuberculosis, leprosy, AIDS, and recently the deadly pandemic COVID. In present times, just like education, public healthcare also forms a key to the success of a nation. And therefore, our public healthcare system also needs to be given equal importance. As the need of the hour is to educate and guide our students about the career opportunities in the field of public healthcare, this career counseling webinar is being organized jointly by Deshbandhu College, University of Delhi, and Indian Institute of Public Health, Delhi, as fifth event under the flagship of Vidhya Vistar scheme and IQAC of Deshbandhu College. To begin with, we ask for forgiveness for any technical glitch that could happen during the program, and we request all the participants to endure with us. This webinar is being live telecast on the YouTube channel of Deshbandhu College. The link will be shared in the chat box in a while. I would now request our dynamic and compassionate Principal Sir, Professor Rajiv Agrawal Sir, to address the audience. Over to you, sir.
Thank you, Dr. Madhu. Invited speaker for today's event, Dr. Samiksha Singh. My counterpart from Pettigrew College, K.S. Soreng Singh. Conveners of Vidhya Vistar scheme from Deshbandhu College, Dr. Moses Renchoy, Dr. Parul Singh. Conveners Vidhya Vistar scheme from Pettigrew College, Mr. Kapun Singh and Dr. Negami. Conveners, Dr. Anand Kumar, Dr. Aparna Shekhar. Event coordinators, Dr. Madhurani, Dr. Leena Agrawal, our Vice Principal, Dr. Kamal Gupta, IQAC Coordinator, Dr. Aditya Saxena. Very good morning and greetings to you all. I welcome you today on behalf of entire Deshbandhu community to this wonderful webinar on public health, which is organized in collaboration with Indian Institute of Public Health, Delhi, Public Health Foundation of India, jointly with Pettigrew College, Manipur, under the Vidhya Vistar scheme. Vidhya Vistar scheme is a scheme which was launched by University of Delhi, in which we share our resources, physically as well as virtually, as well as intellectually with the remote colleges of India, so that both the colleges, both the institutes benefited by this scheme. Today we have amongst us Dr. Samiksha Singh, Additional Professor, Public Health Foundation of India, who will be shortly deliver a lecture on avenues of public health career opportunity. We welcome you, Dr. Singh.
Thank you, sir.
Friends, public health involves medical care provided within a community and outside a hospital settings. In a different context, public health can have global repercussions and refer to efforts to prevent epidemics and improve the health of entire nations. Public health professionals are involved in everything from identifying disease to creating public policy to help refugees integrate into new communities. Now, more than ever, most of the world has witnessed firsthand a public health crisis recently, and there will be no shortage or demands of well-trained public health professionals. A right approach to choose as a career in public health is to have a guided awareness about the vast opportunities it brings to aspiring students from diverse backgrounds. Well-trained experts from the field of communication, bioinformatics, policy research, law, urban planning, statistical data analysis, programmers, etc. All these individuals beyond immediate medical academic training may look for a profession career in public health. I'm sure today's webinar will enlighten us more on this area and leave our students and all participants immensely benefited. In the end, I would like to thank all the organizers from Pettigrew College as well as from my college, Deshbandhu College, for organizing this wonderful event. My best wishes for the event. Thank you very much.
Thank you so much, sir, for your encouraging words and your blessings. I would now request Dr. Bhela Bhatia ma'am, Associate Professor in Department of Botany and Science Coordinator for Vidhya Vistar scheme at Deshbandhu College, to introduce the Vidhya Vistar scheme to the participants. Bhela ma'am.
A very happy morning to all of you. Deshbandhu College, University of Delhi, and Pettigrew College, Manipur, once again welcome you all to the platform of Vidhya Vistar scheme. This is an initiative of University of Delhi to enhance the collaboration between various institutions. Under the able guidance of our principal, Professor Rajiv Agarwal, and Shri K.A.S. Suraisha, Principal, Pettigrew College, we have been organizing various events to enhance the collaboration and to guide our students for their career advancements. Apart from the subject-specific programs, we have highlighted issues related to the environment, such as sustainable development, those concerning human well-being, such as stress management, and workshops on yogasana and pranayams. In this series, we are going to focus on a very important aspect of human existence, and that is public health. This field of medicine concerning with the prevention of diseases becomes more relevant in this time of COVID-19 pandemic. Medicine is a good index of progress for any civilization. The influence of air, climate, and season on the health, as recognized by Hippocrates and Sydenham, who is considered as the father of epidemiology, cannot be ignored in this time. Also, the prevention of occupational diseases is gradually assuming all its importance now. The prevention of diseases in the society is a chief means of prolonging life and of enhancing the standard of individual health. Today's webinar will focus on various aspects of public health and different opportunities to build a career in public health. The esteemed speaker for the day, Dr. Samiksha Singh, will inform and educate our young participants about the different opportunities and the courses offered in this field of public health. I hope this will be a very interesting and useful session for all of us. With these words, I request Dr. Anand Kumar to carry forward and introduce our speaker. Dr. Anand Kumar.
Thank you, ma'am. Good morning, Namaskar. We all are here as a part of Vidhya Vistar scheme under our partner Patrick College, Manipur. As a part of this program, the Sundhu College has organized a career counseling session webinar on the topic Avenues in Public Healthcare. This event is aimed to make the students aware of the job opportunities and courses offered in public healthcare at PHFI. Without further ado, I would like to introduce Dr. Samiksha Singh, additional professor at PHFI, who is the speaker for today's event. Dr. Samiksha has done PhD in epidemiology and population health from London School of Hygiene and Tropical Medicine. She has also done MD in community medicine from UCMS Delhi and MBBS from Lady Hardinge Medical College Delhi. Dr. Samiksha Singh is an epidemiologist and a fervent public health specialist. Most of her research, technical support, and capacity building has been focused on maternal and neonatal health, early childhood development, mosquito-borne infections, and HIV. She has worked with several national, international partners and government entities. As an epidemiologist, Dr. Samiksha is the recipient of several international and national grants and has led evaluations of complex public health programs, health systems, and implementation research. She has more than 25 articles in peer-reviewed journals, and she also served as the academic editor for Plus One. In public health practice, Dr. Samiksha has a wide experience in framing policy, implementing and monitoring programs, and building collaborations. She leads the advanced collaboration of early childhood development and empowerment that brings experts from all over the country on capacity building and research. She has designed, developed, and implemented training programs for public health managers, administrators, and healthcare workers, and degree programs. Dr. Samiksha has a lot of experience under her belt. Now, I request Dr. Samiksha Singh kindly address the gathering. Over to you, ma'am, please. Dr. Samiksha Singh, ma'am.
Thank you, everyone.
Thank
It's an opportunity to talk to you all, and thanks for this opportunity. We always look forward to talking to a wide range of students coming from different walks of life and from different domains of education, be it science, social sector, development sector, be it economics, of course, mathematics, or even historical backgrounds. Public health has requirement uh, from every field, and in India, the concept of public health has been very recent. In fact, we would like to introduce you to how the Public Health Foundation of India came into being, and will give you the sense of the gravity and the importance of it. In 2006, till that time, public health was seen as, yes, programs you must have heard about, because if you're in botany or zoology, you must have heard about certain programs related to malaria programs, dengue programs, and a lot of different infection related programs were being conducted in the country. Maternal and child health related programs were being conducted in the country. Along with that, clinical care and a lot of investment into hospital based care and clinic based care. But public health is beyond these things. Public health is a preventive, promotive way of living, and support provided by the society, by the administrators, by policymakers and managers to ensure that we provide enabling environment for every individual to be able to live a healthy life to best of their potential. Our children should be able to achieve their highest developmental potential, and our societies by and large are more harmonious and in good health. That's the purpose of public health. And when you want to achieve such kind of level of health of a society, it cannot be given just by doctors or health service providers. It cannot be just provided by hospitals and clinics because it is a way of life itself. Then there are concepts of social determinants of health, which determine health of people. Of late, you have heard a lot of talk and evidence into lifestyle changes for better health, exercise, eating healthy. All of this is part of public health. But we have not been able to see public health in that a manner in our country, and that's a reason that we could not work towards integrated and comprehensive policies and programs keeping overall public health in mind. We did have very good health infrastructure, uh, mainly in cities, but growing in rural areas as well. So in 2006, PHFI was launched because the government of India felt a dire need to have a certain body which can build the capacity of our community, of our society, of our health programs, of our administrators towards public health, right? So it was set up as an independent foundation and was registered as a society. And we got funding from various government and international foundations. Main donors were Government of India. Then we had donors from Bill and Melinda Gates Foundation, DFID, and like many other donors. Just to give you a glimpse that in 2006 we were able to start with funding donations of almost 100 crores Indian rupees. So that was the kind of vision and the importance that was seen for Public Health Foundation of India. And we till date continue to work for building public health institutional capacities. And the institute itself was launched by the Prime Minister then, Manmohan Singh, Dr. Manmohan Singh. So how it started, in fact, just a little bit history about that also. The need for public health was such, and even when they were hiring people to start this institute, not many of us were aware about what public health should be like, what should be teaching, what should be training for, what should be building capacity for, how should we doing policy and advocacy. You will learn about these terms in a bit. The investment into planning of this organization was such that it was a very stringent interview process of people who are already working in fields of public health. They may be doctors, they may not be doctors, but they were keen contributors to public health in their own ways and wanted to pursue this as a career and take it as a mission in the country. A handful of such experts were identified and they were sent across the world to do their masters in public health from the universities of US, UK, Europe, Australia. So we had MOUs with several universities. And today the faculty that we have in Public Health Foundation of India, or the researchers that we have, or the policy advocacy people we have, most of them have international degrees and have been trained to take agenda of public health in the country. So what we started in 2006, and the trainings and actual work started from 2008 in Hyderabad. We are since then trying to spread this message and trying to build the capacity of as many as we can go ahead. So how do we work? We mainly work with 4 sectors and 4 set of people. Because it is public health, obviously the main stakeholder is government. We very closely work with Ministry of Health and Family Welfare and other ministries, both at national and state levels. So we have MOUs with national government, PHFI Foundation. The central body has MOU with Government of India, as well as at state level, because you may know a lot of subjects are state matters. Health is one of them. Ministry of Health and Family Welfare. Sorry, just give me a second. The Ministry of Health and Family Welfare, Government of India, has MOU with PHFI. But at the same time, because health is a state subject, we also work with state governments. Like Hyderabad has MOUs with state governments of Telangana, Karnataka, and Andhra Pradesh. Hyderabad, Bhubaneswar Institute, Indian Institute of Public Health, Bhubaneswar has MOU with the Orissa government. We have another institute in Shillong working with Meghalaya government. We have another one in Ahmedabad working with the west side of the India, and Delhi is working with the northern states. So we have our spread along with the different states, and how we work with the governments are that we support them wherever they require our support. For example, from the central government, we very closely support AIDS control program. We have been very closely supporting immunization program of children and polio eradication, maternal and child health. So we have experts in various task forces. Will you just give me a minute, please? I'll be just back. Sorry for that break. I'm sure the lecturers here would understand. The lecturers cough and a simple lozenges do help us when we are taking lectures. I hope the strepsils help my throat. Sorry about that break. I've been coming out of viral and did not realize that when I'll be delivering a lecture, it would trouble me. Okay, so let's continue. Okay, so we have been providing them support in various programs. Apart from providing them direct support into how the policies and programs have to be made, we also do evaluations for them. They time and again they do ask us to review their programs, to evaluate their programs, to give them feedback on what is working and what is not working, and where we should be improving. So that's one kind of support that we do with government agencies, and it's not just restricted to the offices. At state level, we even go up to the primary healthcare centers and review the health systems. There, we recently supported a review of labor rooms and newborn units in state of Telangana, to give them a length of guidelines how they should be improved. And as a result of it, there were a lot of infrastructural changes at a local level to improve those services. Apart from just the infrastructural capacity, we work on human resource capacities also. Like whenever, like for COVID, for instance, when COVID came, we were supporting a lot of state governments into their policies, what they should be doing in their states. Apart from that, a lot of work into training, development of IEC material, and building capacity of different stakeholders was also our role. I'm giving you an example of COVID because it is very recent and you will realize the importance. So we were instrumental in conducting trainings and ensuring resources via state for clinical care of COVID patients who would get isolated or quarantined. At the same time, we were helping state governments in case follow-ups, in epidemiological investigation of the COVID pandemic, in house-to-house contact tracing. We were helping state governments in keeping record of all those things and see how it is progressing or how it is kept under control. At the same time, there are different stakeholders who needed to be informed about COVID. You remember migration crisis, right? So We, at the time of migration, we were building capacity. We trained railway police, we trained general police. A lot of other things were happening in different states. I'm just telling a few about how they have to handle such situations from infection control point of view, as well as from counseling point of view, as well as social aspects of it, and how to manage in conflict situations. So public health then grew beyond just infection control. It also became played a role in conflict management and people's management. We were engaged in capacity building of metros. Before they should open, what should be they be considering? So a lot of such things, even panchayats for that matter. In Andhra Pradesh, all the panchayat secretaries in Andhra and Telangana were trained how they should be contributing and supporting the state government policies for control of COVID-19. So this is just an example that how we work with state governments, and we work with variety of people. Now, the, as a routine, we run certain courses for in-service public health in-service doctors and nurses and paramedical staff and administrators in government services, and we run postgraduate diploma courses for them. All the public health programs are run through a government machinery with government resources. These are doctors who have been working in PHCs or CHCs or district administration and have never been trained for management or people's management or programs management or public health for that matter. So we do run courses for existing human resource to be able to understand public health and to be able to deliver these public health programs to much more efficiency. That's what how we interact with the government. Next group is academia. So we partner with a lot of national and international public health schools and a lot of national experts who are into academic review of disease, their determinants, their control, interventions, and programs. And we do a lot of research and policy building along with international academicians. So there is a lot of sharing of information and knowledge and learning from what has been successful in their settings and adapting it to what may be successful in our settings. So a lot of our work is research based. As we are an institute, we believe that every policy program that we do has to have a evidence base, right? Then the next group of leaders or the sector that we work is the industry. And by industry, we mean anything from pharmaceutical industry to occupational manufacturing industries to IT sector to global corporations, global philanthropists. We work with them in different ways. Like with some pharmaceutical companies, we may work on supporting them and building their capacity for maybe clinical trials or supporting them testing out some drugs at population level. Or we do some public health programs for the corporate sector employees, or we have their CSR divisions who want to invest into public health and do some research or community-based interventions for improving public health of a certain society in a certain region. So we do work with the industry in that manner and support them. Lastly, we work with civil society organizations, a lot of NGOs, not just restricted to health. These are the times, especially in COVID, you would have seen that it's not just health that came in to control COVID pandemic. They were all different sectors, especially rural development, poverty alleviation, Mahila Mandals, micro ecosystems or micro economic based organizations, whoever could bring people together, whoever were heard, and in whatever way we could influence the behavior of people, all those NGOs work together in COVID-19 pandemic. But in routine health, if you see, health a good health or a positive health that we aspire to achieve can be achieved only when we have good infrastructural development, economic development, social development, education, all together then supports to head for positive health. So in today's world, the development word as development includes health in it, and health, if we talk about public health, it works along with other development aspects uh, related to gender, related to inequity, related to societal disadvantages, be it caste or religion, anything. So public health needs to break all those barriers to be able to ensure everyone receives care what they are entitled to as per their right, and that's what we work towards. So broadly, what we try to do, we try to first prevent disease by having a lot of preventive and promotive approach. Like the immunization program is one way of preventing diseases. Lifestyle changes, tobacco control, injury prevention. These are all kind of programs which are into prevention of disease. And if you look at the terms I use, lifestyle changes, you don't have to be a medical doctor to be able to promote that kind of a health program, right? So a lot of things in prevention of disease are basic sciences, home sciences, basic socio-anthropological aspects, behaviors, surveillance of them, what is happening, its statistics. So there are a lot of aspects in prevention of disease which actually do not require a medical profession. So we work a lot towards that. Then our goal, as we are into capacity building of public health in various cadres, so we aspire for benchmarking standards in public health education. So we do a lot of courses, and we'll show you. We try to benchmark the quality of that public health education that should be provided across the country. So we have collaborations with several leaders, and we keep looking into the quality of courses that we provide or making recommendations for capacity building of different cadres across the country. Prevention of disease, along with that comes the promotion of health, a promotion of positive health. So lifestyle is one of those examples, but as well as people, once they're diseased, even then they're entitled for the best possible health status they can achieve. They can go towards complete cure, they can go towards recovery and rehabilitation. Even people who are disabled in any manner have the right to have the best of health which they can have given their situation. So public health expands to health systems also, where we look into the quality of care being provided, the clinical protocols, the quality of clinical protocols, the revisions of them, the infrastructure, the equipment, logistics management, human resource management. All those things also come under ambit of public health, right? So if I use the term management so much, in a very lay language, sometimes if people don't understand what do public health people do, apart from if you don't talk about epidemiologists or academicians, I just tell them, oh, they're kind of managers. As you have MBAs setting up your big companies, we are managers setting up public health for our societies and our country. So it's a little difficult to understand as such what is public health specialist, but in a nutshell, they are leaders, they are advocates, they are managers who are taking agenda of public health ahead, understanding different aspects of health and health service delivery. We at PHFI focus on 12 thematic areas in preventing and promotion of health. These are mental health, maternal and child health, violence against women, environment and air pollution, infectious diseases, non-communicable diseases, water and sanitation, injuries, health system, policy and financing, even insurance, health insurance, Ayushman Bharat, all these kind of schemes also come under public health. And just to tell you, many of these domains like health system, policy and financing are led by economic experts, not necessarily by science experts, right? Because it requires understanding of economics and financing along with understanding of the disease. We look into disability, we look into nutrition. Again, nutrition is one field where a lot of development sector people, nutritionists, have understood public health and grown up to a level where they are experts in public health nutrition rather than just one-to-one nutrition. Then social determinants of health. You cannot achieve positive health unless you understand social determinants of health and try to improve their status. So these are the broad domains we work in. And I want you all to just have a look at these and try to see, don't you all fit into any of these domains, right? If you look at any of these domains, it requires a lot of understanding of like infectious disease. If you see, a lot of zoonotic diseases are coming into play, and people who have done any graduation, post graduation related to zoology or zoonotics are doing very well these days. COVID spread from animals to humans, broke that barrier, and it has spread. A lot of research is going on in that. Antibiotic resistance. People from sciences background, any sciences background are working on it. Environment and air pollution. A lot of people from science background, physics background, chemistry background, they are working in environmental and air pollution. Social background, they are working in environmental and air pollution. Violence against women. Anthropologists, psychologists, different people, even experts, history honors people may come who are interested in aspects of status of women in the society, and they have moved towards working in women health and violence against women health. Law, people from law are working in these domains. So that's a range of activities that public health has. And we, just a small pool of doctors, trained doctors, are, I'll be honest to accept that, are not capable enough to deal or address all these wide range of requirements that public health brings with it. So it's an opportunity, and it's always a call from our side that we invite as many people, as many students from different graduation backgrounds to come and contribute, partner with us, and work with us. Right? Currently, in our institute, also, we are not all doctors. We have nutritionists, we have social anthropologists, we have engineers, we have someone from law background, we have someone from Ayush background, we have people from they must have done basic sciences or worked into counseling. They are into public health, and at various levels, from directors of certain institutes, public health or different institutes, up to researchers. So, and there's a huge growth possible. So how do we deliver these aspects? Coming to PHFI, being our motto in our academic programs, we run a lot of campus programs. We do a lot of professional trainings through certificate courses in different aspects of public health. We do fellowships and partnerships, and wherever required, in the government, we do research and evaluations. But apart from that, we do a lot of basic research for health systems innovations and look at different technologies that can be brought into public health. And this range of innovation ranges from, for example, what is the best way of bringing parenting or early learning for the children to the community level. It may not require a machinery, but it may require a program to be delivered in an innovative manner. At the same time, There are programs in public health in one of our institutes where they're looking at application where people who are disabled, right, they have to get a certification of their disability when they apply for any jobs or they have to attain any benefits. They have to visit certain hospitals to get those certifications, and they are not even aware at what level of disability they are to be able to apply for certain benefits. So there is a app being developed which is more visual based, that if you move in front of the camera with the range of movement, the maximum movements you do, it gives you an instruction, and automatically that app can give you the level of disability as per the standard grading. So there are people who are into IT sector and developing such kind of applications which can be used for betterment of people in different aspects of health. A lot of IT interventions have been done for diabetes, how they can monitor their sugar levels, how they can keep track of their medicines, how they can keep track of their exercises and lifestyle, a lot of things. IT and manufacturing industry, or and physicists, they're so much into development of machineries. How do you think ultrasounds and CT scans, they all came into being? Because we had core sciences people working towards towards health, but now that has extended into public health. For example, if you remember during the COVID times, earlier, how would we take and do analysis testing for COVID? We were doing nasal swabs and doing a PCR technique. It's core science. It's pure science. It's not health science. It's pure science. How to extract DNA and multiply it and be able to identify which virus DNA it is. You all will understand it. So from there, the lab people, they were working towards how we can develop certain tests which can be more rapid in nature and we can test more people. So by that innovations, they came rapid diagnostic kits for COVID-19. We have such rapid diagnostic kits for malaria and for a lot of things. So I'm trying to say that even the people in the labs, core labs who have public health inclination, they work towards developing technology and innovation which will help in delivery of public health programs. Use of drones in delivering drugs or following up of tuberculosis patients if they are taking their treatment timely or not, or if they have not come into the clinic for more than a month, can we track them through some other mechanism? So that is all health system innovation. How can we analyze data? We have huge data, and how we can use it for betterment of decision making, right? So we have huge role of statisticians there, and yeah, so it's a never ending thing. I can give you hundreds and thousands of examples, and all those examples which would not be just related to being a medical doctor or being a medical nurse. Right. So now that you would have understood a little bit about the spectrum of public health and the work that we can do in public health and where you all can fit into public health, I just want to tell you now that at PHFI what courses we run, and there are some other institutes who are also helping people get some expertise and understanding regarding public health. So before we go on to this table, just want to tell you all that public health usually, except for one of the campus, is a subject which you take post-graduation, right, after graduation. And I've seen that the core science that you have or core degree that you have, you build upon that. Most of the time, that is the advice I give to people, that if you have come from dental sciences, try to make the best use of that knowledge that you have already gained. Learn concepts of public health management, public health systems, public health evaluations, and apply that to your basic science. Then you will go many steps further. That's always advisable, but at the same time, lot of people change the course also to pure policy making, pure advocacy, pure health management, and become public health managers. So it can be both ways. Never feel that if you have done a graduation in certain subject, you are leaving that behind. It always stays with you. It always stays as your strength, even when you move ahead with public health. So what we do is that we do a range of courses, and with duration, we do a lot of short courses for people who are already in the service and just want to update some of their knowledge and skills. These can range from 5-day short courses to 1 month short courses, right? And when they are a little longer, we do skill enhancing certificate courses. Some of them are run on campus, uh, on a regular basis, and some others are developed on demand of the governments that we work with. We work with both public and private sector. A lot of private sector who are into health related industry also come to us for several different kind of certificate courses. And we do courses as a mix of clinic and non-clinic subjects. So it's not just clinical subjects I'm talking about. It can be a lot of non-clinical subjects which we run as certificate courses. Then for people who are looking at gaining the knowledge and proper degree in public health, we do run two courses: public health postgraduate diploma in public health management and masters in public health. Postgraduate diploma is a 1-year program, and masters is a 2-year program. And a lot of students join us, and I'll just show you that we run it through various campuses. In few campuses, we also have PhDs. Like in Delhi, we have PhD for clinical research, and in Hyderabad, we have PhD for information technology, where they work with, as I said, a lot of innovation using technology and communication for health promotion. These are usually on-campus courses, but we also have some small, short 3-month to 9-month e-learning programs, also distance e-learning programs as well. I'll show you the list of those towards the end. So these are the opportunities for learning about public health that we offer at PHFI. So just to give you a glimpse, when we started our academic programs in 2008, 2009, we just started with 3 centers providing postgraduate diploma in public health management, in biostatistics, and health education and promotion. These were the 3 different courses that we started with. And we used to have students from all over the countries, from different states, coming and studying at these institutes. These used to be residential courses because most of our candidates were nominees by the state governments themselves. From there, in 2022-23, we are grown to provide 11 programs. We have now 6 sites where we are providing any of our capacity building programs because the demand increased. And as the regional demands increased, we started opening up regional institutes as well. And you can see that we provide PGDPHM, MPH courses, masters in hospital administration, certificate courses in geriatric health, a different kind of courses from different institutes. This information is available on our site. You can have a look there. Now, apart from capacity building and working closely with the governments in innovation, our main contribution is generating evidence as well. So we are huge in doing research, and as per WHO, public health is all organized measures to prevent disease, promote health, and prolong life among the population as a whole. So when public health is that, so we need to know, okay, what is the burden of the disease? What should be done to prevent? How do we prevent? What should be done to promote health? How do we promote health? How can we prolong life? From what to what? So when we talk about public health, we simultaneously have a lot of questions coming in. And we try to address those questions by doing a lot of research. So if you look at core functions of public health, what is public health supposed to do? They are supposed to do assess what is the ground situation, generate evidence, based on that tell policymakers or along with policymakers develop policies which are pro population health and assure that those policies are delivered through programs. You develop programs, you implement programs, and you assure that they are effectively implemented. The quality of implementation, the rigor of implementation is well done. So, in all these three functions, research plays a big role. Assessment, situational analysis, policy research. The research which is specifically to look into the quality of policy, what are the gaps, what are required, and how and what policies should be developed. Implementation, you do implementation research or evaluations. So public health and research go hand in hand, and that's our speciality. We not just talk about technical support to state governments or national governments, we talk about evidence based support to any of the core functions. So in assessment, as I've already said, you try to assess what are the community health needs, what are the possible hazards and their effects that we should to control them, and analyze any other determinants and factors which can influence health. In policy development, as academicians, as public health specialists, you are the first ones to identify where the gaps are. And based on that, you start advocating with policymakers, please invest money in this, please look into this factor, please look into tobacco control, or look into gender-based violence, or look into early childhood development. We need policies like this, we need programs like this. You need to prioritize these, because in our society maternal child health is still a problem. Or somebody would say at the same time, non-communicable diseases are increasing. We are at a juncture where we are dealing with infectious diseases and non-communicable diseases. So people who are advocating for infectious diseases try to convince for what should be done in infectious diseases, and similarly, people who have identified gaps and needs of the community towards non-communicable diseases try to influence policymakers on what should be done for non-communicable diseases. So we as public health managers and researchers identify those needs, look holistically, prioritize where we should invest our money, and then help governments in planning and developing policies. In assurance, again, you look at how you implement those policies as programs. What resources would be required? How do you do these resources? How logistics management? If we have people from here in from economics or financing or in different fields, logistics management is a big headache in public health, because you may have development of resources is one factor, but to be able to ensure that they are delivered and they are in well working situation, their repair, from drugs to equipment to beds, whatnot. So, and this is just about the equipment and drugs. I'm talking about human resource management. How do we develop the cadre, their career pathways, their incentives, their salaries, a lot of that. And because public health is a newer stream, everybody is working towards it. We are learning every day. So a lot of work and resource goes into actual management. What many of the people will learn in MBAs, lot of principles of management from industry are applied in public health management. So we do look forward to MBAs and such experts coming and helping us. You must have heard about things like Bitcoin, blockchain. Younger generation is aware of these things. I don't understand that even till date. How does blockchain work? But I was surprised to know that in certain areas in Africa, they were trying the concept of blockchain to map distribution of vaccines and their viability till the last end. Imagine, and I'm limited in my understanding of blockchain. I can just feel wow. But people who have interest, they have taken their own learnings, their own expertise, and tried to solve public health problems. So a lot of work goes into management of programs and delivery of services. And by this, I don't mean just hospital management. I mean overall public health program resource distribution and management. Then actually implementing the programs. So when we implement programs, we do have cadres like public health managers, public health leaders, or field workers. So similar kind of, we are growing as an industry when we talk about public health. So implementing programs, evaluating the programs, and then informing the public what programs are being run, what behavior is expected out of them, where they can go and seek health care. That is all part of public health assurance. And at each level, we keep doing research. So, why should we invest into public health? Actually, it's a very wise investment. It's if you look at preventive and promotive health and ensuring good health of people, you are saving money. Uh, Money spent in preventive and promotive health in long term saves money that is required to spend on chronic diseases, cancer treatments at an individual level as well as at a systems level. The amount you have to invest into maintaining tertiary care and be able to provide tertiary surgical and palliative care to every individual is much bigger than the amount we may need to invest into preventive and promotive health of the society, which in long run is healthier. Not just you save money, a healthier population, contributes to more earning, right? So it's not just saving money, it's also earning more money if you invest in public health. Above that, you enjoy good health, you enjoy good life, you are happier, you live longer if you are in a positive health status. So currently all, not just health sector, even development sector is understanding that investing into positive health, societal development is a core towards better societies in times to come. So now coming back to research again, that every aspect that we talked about public health, and we at Public Health Foundation of India feel that research is core to that. And how do we do research is we identify a specific investigation area, any area where, let's say, tuberculosis, or let's say zoonotic diseases or diabetes, any area. And we have the skill set for doing systematic investigations. So when we combine them, then we do a research. We do systematic research about any area of concern to bring about facts which are to recommend changes for betterment of humanity. It's a very complex process that if we want to do any investigation, it requires the policy need or programmers need to bring about change. Doing any research doesn't lead to change. You have to identify areas which are of interest or of priority. Then you need a lot of funds to be able to do that. So as we said, we work with a lot of industry, we get philanthropists money. Public health is not a money making sector, right? We do get well paid, I must tell you, we have good salaries, but it is not a money making sector. It is usually run by the social responsibility of the governments as well as philanthropists who pull in a lot of money in public health. And we need a lot of skilled manpower and other resources to be able to do investigation. So to bring all of this together, first we strive for that. We write grants, we get fundings, like many of your faculty would be doing too. And then we identify relevant area. Who will benefit with that area of interest? So you have to very carefully choose the research priority area and conduct research. And research should be conducted in a manner that it is trustworthy. Why would anybody believe what I say? So we spent a lot of capacity building and forming up teams and do research in a very scientific, elaborate manner. We have ethical committees, we have review boards, we have experts on board who time and again review our research practices. We publish a lot. This is to tell you that last year, PHFI was identified as one of the institutes of the universities amongst the top one to have the maximum number of publications or the highest number of publications in peer-reviewed journals. So we just don't do research, we look at quality research, we do a lot of publications. In a year, we may have 300 plus publications from all the faculty and staff combined across PHFI. And each of that research is towards public health, trying to influence any change in programs and policies or improving the way programs are run. So that's how we do it. Ultimately, what we want is that whatever change we suggest or we look at is acceptable to policymakers, program managers, and community. It is available. The services, the quality of care, the preventive and promotive aspects of health are available to every individual. They're affordable, right? And they're accessible. Everybody, even up to the rural and the tribal population, should have opportunity and should have access to basic health. That's our purpose of doing research as well as evidence-based policy support and technical support to governments. That's a very complex process which we work into. So you all are in core sciences. So just to give you a parallel to what in core sciences happen is that you invent something, you test something, and you implement. So in public health, it's something like that. You do basic research to find what are the problems and gaps in the society, what are the solutions to them. They can be industrial solutions, they can be pharmaceutical solutions, they can be managerial solutions, they can be operational solutions, they can be logistic chain related solutions. Then we do clinical research. We have population-based clinical research. By clinical research, it may not always be pharmaceutical drug-based research. Clinical research, by that we mean any experiment at a community level. And once we prove that public health intervention works, then we implement it as a program at a very large level. And then we do public health research, which looks at assessment, policy interventions, improvements, and overall program evaluations. So this is how public health research looks like, as similar to what many of you would already be doing or would be intending to do. So coming back to COVID-19, COVID-19 has taught us that it is not limited to health, right? Health is not limited to only health sector. And when the pandemic came in, we needed to first identify where it originated from, how can we diagnose it, how can we treat it, and further, how can we prevent it from spreading. So if you look at it, we have basic scientists working on towards genome sequencing and identifying the type of virus, its presentation, right? We had epidemiologists looking at outbreak investigations. To diagnose, we had biotechnology people looking into developing the accurate measures of diagnosing it, affordable and fast measures. Pharmaceutical companies went into mass vaccine productions and drugs, repurposing drugs for treatment. A lot of evidence was to be required, a lot of clinical trials were required to identify which treatments work. And the improvement of patient care was also brought in. Infection control became so much important in hospital care COVID-19, which was a little lacking behind earlier, but because it was spreading from patients to doctors also. So infection control in hospitals became very important. And not just care. Post-COVID, it was so debilitating. People were feeling so weak, and people who were recovering from severe diseases required rehabilitation back into the societies, both in physical manner, in psychological manner, A lot of mental health problems occurred, not just with the patients, their caregivers, their neighbors, a lot of stigma related to COVID-19. And we had public health managers working round the clock in trying to see that all these different aspects of health and system and societal interventions talk to each other. They are aligned with each others, and different components of health uh, or disaster management or infection control are aligned with each other. You would know that in COVID-19 pandemic control, it was the disaster management, the National Disaster Management Center that took a lead, and that those came up with the act for control. It was not the Ministry of Health, right? So it came under the fall of disaster management, and public health managers are broadly looking at everything falls into place. It also brought to fore the behavioral scientists uh, who did a lot of research into and support in planning IEC material, how to influence the behavior of the societies by and large, right? Because making people wear masks all the time, staying at home, washing their hands properly, I guess was amongst the biggest and the most difficult tasks in COVID-19 pandemic control, rather than managing patients arranging for oxygens. Although news covered arranging for oxygens, that was very difficult, definitely. But for larger public health control, public level, population level control of pandemic, the most difficult part even till today is to be able to make people understand that they have to continue wearing masks, they have to maintain social distancing, they have to do hand hygiene. And behavioral scientists work and do a lot of insight looking into it, how we can influence those behaviors. So those were the kind of lessons we learned from COVID-19. And we have been working in developing the capacities in public health for all different sectors, and call for more people from different sectors to join public health. Now, because we were talking about research and research capacity, this graph is to show you what are the requirements in research capacity for public health in the world. So the topmost here is the high income countries, and this is the Southeast Asian countries where we are. We'll not look at others. Just for the key message, we can show you here. So the blue ones are the efforts that are being done, and the yellow ones are the gaps in the amount of public health research that is required in that area. So in high income countries, a lot of work is already being done in research of public health or health. When you look at Southeast Asian region, very little is being done, and there are huge gaps in public health research capacity in our region. So that itself tells you that there are opportunities, and slowly the capacity, human resource capacity, is growing, as well as the funding is growing in public health research and public health programs. A lot of institutes from the West, be it US, Australia, UK, leading institute. There are leading institutes of public health like London School of Hygiene and Tropical Medicine. I did my PhD from there. It is amongst the top 3. We have John Hopkins in US. We have Harvard University. In Australia, we have George University. From New York, we have Columbia University. All these people do a lot of public health research and do a lot of advocacy and policy making support. They are opening up their institutes or their satellite institutes in India. So we have Population Council from US. So I'm just talking about the research aspect. I'm not even talking about WHO, UNICEF, CDC. They already have their offices in India. But when I'm talking about research, a lot of institutes have already opened their offices or their satellite institutes in India to be able to do research in Southeast Asian region, to be able to innovate new programs, and to be able to support the state governments or the national governments or the NGOs. So it is growing. It is growing. It is growing very fast and with a lot of opportunities that are to come. So just to show you here that if you look at the current trend, right, and there is no further improvement in investment in public health, we still have 21,000 gap in the professionals. We need 21,000 gap in 2026. If the funding seems to increase the way it is increasing, if the way people are coming in and the requirement, investment come requirement is growing, in 2026 we are looking at the public health professional requirement of around 45,000 people, and this is the gap that we need to fill. And that's why we're doing a lot of these lectures to invite students to even consider public health as a profession, because you definitely have opportunities there. So now if you decide or if you feel inclined towards taking public health as one of your careers, so where would you start? So I can just tell you from our side that what we offer, we are amongst the biggest organizations to offer public health related courses. Apart from that, we do have certain other medical colleges and universities. They also offer certain MPH and PG diploma courses, but ours is the biggest network. So we offer Masters in Public Health. It's a 2-year program, and you can already read the list of qualifications. It's a wide range of students who can apply from various degrees. I've already mentioned most of them. So the last day to apply was 31st May 2022, but for the colleges or the places where we still doing these lectures, if you write to us specifically, we may think of considering your application, but you'll have to directly mail it to us. Applications on the portal would have closed, but nonetheless, we open every year. So if you are still in final year, the best opportunity for you all would be to apply next year. The Master of Public Health is very competency driven. We prepare students for management, problem solving, critical thinking, or public health domains. We train them to be able to take public health research, and we give them field exposures. We give a lot of our students internships into our own existing research work so that they get hands-on experience of what's happening in the field. We give them an idea of the social, cultural, and economic diverse populations. We do take them for field visits for to reviewing vulnerable populations, disadvantages groups, and how the health systems exist and address the needs of such populations. So they get to learn about the public health systems, their financings, their operations, their working, public health policy. We teach all of that to our students. We see that our students are going to be future managers and leaders because everyone is going into that direction. That's where the gaps are. So we do also impart a lot of soft skills, leadership and effective communication skills by engaging them into presentations or tasks or different kind of activities that we do at the institute. We have a USP that we have lot of network with national and international organizations. So we also bring in experts from remotely or directly to deliver lectures and share experiences. They can be people from the ministry, or they can be a lecturer or a professor from a university, or they can be a director of a program in a private sector. So we give them exposure to the whole range of experts. Another course that we run is a 1-year postgraduate diploma course. This is a 1-year course. People think have a lot of skill set already, but they just need some orientation towards public health management. For them, this is a very good course. Mostly the government employees are nominated, state governments nominate their employees for this course. And here we have listed people from medical and paramedical, life sciences, and social sciences background who can apply for this course after graduation. Uh, Postgraduate diploma in public health management, we are very particular that it has highest quality, and we have a consortium, and this course is being delivered by various institutes, as you can see on the map, and they meet regularly to ensure that we maintain the curriculum, the quality of teaching, and the faculties also cross teach and evaluate each other's performances in students' assessments. We do run certain MSc and PhD programs. Okay, so I need to tell you that most of our degree courses are affiliated to different universities. Like Gandhinagar has its own university. IAPH Delhi has affiliation through Academy of Scientific and Innovative Research, AXIR, we call it. Hyderabad and has affiliation with Kaloji University in Telangana. Bhubaneswar has affiliation with a regional university. So the different institutes have affiliations from different universities. Gandhinagar has been able to get a state university status, and soon Hyderabad is also going to get a state university status or public health dedicated university. So we do run MSc and PhD program in clinical research in Delhi. And for core sciences people, it's a very good opportunity. It's an integrated program. You can go for MSc followed by PhD. And a lot of our students from MSc, PhD in clinical research get placed in good industry. As I was mentioning about EXIR offers a lot of scientific courses. You can go to their site. Clinical research is one of them. Health informatics is also one of our courses run through Hyderabad, apart from many other core sciences courses. So the unique feature of our programs is that we are very focused on the competencies. It is not just theoretical curriculum. We have very highly experienced multidisciplinary faculty. People who are expert in their domains only teach. Like if I am an expert in epidemiology and maternal and child health, my research, my technical support to state governments in that field, so I only teach those subjects. So we always find experts who are practicing that domain they teach. So we take practice and teaching hand in hand. So as I am teaching, then obviously because I'm working with the governments and NGOs, I directly link my students with the actual public health practice. We inculcate and emphasize a lot on managerial skills, problem solving, case-based learning, pedagogy, and how to teach, how to train, because as managers, public health managers, you have to engage a lot in capacity building of teams. So a lot of other things that we focus on, our programs focus on. So the curriculums are developed that way, and delivery of teaching is also in a similar manner. So we have so far had students from different disciplines, as you can see, and they have also gone to different organizations. So as I was talking about clinical research, the people who have done MSc and PhD from our institutes, they have been placed with research organizations, biotechnology companies, pharmaceutical industries, medical device development companies, pharmacovigilance and auditing companies who audit clinical trials. They are regulatory bodies in the country. So our students have been able to find jobs there. Many of them have gone to clinical data management and several research sites and medical writing. So this is a very focused course, MSc and PhD, and has a good placement. They have joined these industries with different roles as research associates, data managers, statisticians, clinical auditors, managers, regulatory affairs managers, pharmacovigilance managers, quality assurance, drug safety scientists. So people who are in core sciences, they may find MSc clinical research as of interest, even if they are not looking at public health management or public health as such as a domain, but clinical research, the course that we offer, is a good step towards getting into the industry. So, yep, apart from that, our public health students, they join as public health managers, district program coordinators, behavior change management, health economists, epidemiologists, research fellow. Many of our students joined as epidemiologists at state level in different states. And again, I'm repeating it that not all of them, in fact, 90% of them were not doctors. Okay, so don't feel restricted when I'm talking about this. Most of our students so far have been from different fields, right? Medical and nursing, definitely, but apart from that, we have more students from different sectors and different disciplines. These have been our employers for our students. You can see from government, National Health Mission, to state health missions, to international organizations, JAPIGO, INCLIN. We even have things, Novartis here, we have IP Global, we have World Bank, we have UNICEF. So these are the institutes where our students have already been placed, right? Prominent ones. At IIPH Delhi, if you join us, we have very good placement levels. If you see that in 2021, 95% of our students were placed, and that I'm sure that's a very good number. We do have a placement cell, and we do introduce our students to through internships only. We introduce them to industry, and many of us students continue to work wherever they are doing internships. If not, then we have placement opportunities for our students. They have gone to different sectors. Most of them have gone to the development sector, 34% of them. 15% go to the academic and research institutes. 20% have gone to corporate sector like pharmaceutical industries or CSR wings or other aspects that we were showing. A very few, 16% have directly gone to government sector as public health managers or state health managers, NHM managers, and a very few, 15%, continue to do their higher studies in forms of PhDs or other courses. Apart from the placements, we over the years have been also attract a lot of industry and donors to be able to support our students. And amongst the self-enrolled students, we have been able to find some kind of scholarships for our students. In 21-22, 78% of our students were able to avail any form of scholarship. It can be in form of funds or fee waiver or financial support to do research post course, or can be in form of doing internship or some paid internship with a leading industry. So there are a different range of a different variety of scholarships, but all in all, 78% of our students last year benefited with one or the other scholarship program. So if you are interested after this lecture and having to know about our courses, you can apply online through phfi.org on campus courses. You can note down this address, and otherwise, Yogesh, you can please share this information with the coordinator who can share it with all the other students. And I just want to say here that the courses that we offer are not just limited to the students. Even faculty can apply for certain certificate and online courses that we offer if they are of interest to them. So just I'll encourage faculty also to have a look at what courses we offer. And as we work in partnership with different institutes, we always are open to partner with your organizations, your colleges, your institutes for your kind of research which you would like to extend to public health. We will bring our public health expertise our scientific research, epidemiological expertise, and we'll be happy to collaborate with you all to work together in fields of zoology or botany or IT or behavioral sciences. We have been doing that in the past, and we welcome you all to join us in any capacity. So when you apply for the courses, you will have to fill an application form, upload your CV. You will have to give referees, two academic and one professional, in case you have had a professional experience or you have done any internships. Your certificates, you'll have to load them, and you will have to write a statement of purpose of around 200 words. Why would you like to pursue that course? The process of shortlisting is such that once we have applications for a few of our courses, end of June and July is the deadline. We shortlist them, then we conduct interviews, web-based interviews, and then finally we select who all will join us in our courses. These are few photographs from our students and students' life. We do annual one-day fest because we are still growing as a university, but as many students we have, the opportunities or the fests increase. But apart from that, we are very active, engaging life with students. Because we are in public health practice, we try to engage them in a lot of our project work as well. So that makes it interesting. So these are the courses that we are offering in our university. And on the right hand side are the name of the institutes. You can ask me questions while you have a look at this table. I'll hand it over to the organizers and the students. Anybody?
I think, ma'am, your presentation is very much informative and clear to all the students. That's why they have not typed. But I have one question.
Yes.
Can you tell me, is there any internship program for the undergraduate students also?
See, because public health is a very focused field, the programs that we do want the students to have some public health exposure. So most of the time in our own public health programs or researches, we have postgraduate students or MPS students joining in, and even in the industry. That's a frank answer, right? Because they want someone with some understanding of public health. However, having said that, if we have applications coming for internship, we do consider external students also if they come through proper channel, and if we can write a proper statement of purpose, why do they want to do internship. So we do have undergraduate students coming and doing internships from with us, not just India, from international universities as well. Okay, so they are open, but we mostly have unpaid internships. That's what I mean to tell you. But we do have, once we had a nutrition student coming in, then we had I once had a general biology student coming in who wanted to seek career in public health in future, and she came and joined one of my projects and looked at health status of newborns, depending on whatever project I was doing. So yes, we do have that opportunities. uh, do write to us, but it will be unpaid internship and usually for 2 months.
Okay. Because these internship programs will help to decide about their masters, now, whether they are interested to do their masters in.
Yes, very much. If you all are interested, I don't know if our institute has done that ever. If you see there's a pool of students who are interested towards knowing more about public health, maybe we can do some kind of exposure visits for them in our institute, or the kind of work we do, meet different faculty, or even the labs that we may have, or exposure to some programs, government programs. We can think of it provided we see a pool of students feeling interested to learn more about it. So these are the e-programs that we run. As I was telling, that some of the faculty may also be interested in doing any of these. So if you are interested, or your postgraduate students are interested, these can be done simultaneously along with their ongoing courses.
Okay, so thank you, Dr. Samiksha, for such an informative lecture on avenues in public health. So your lecture gives us an overview of public health and the different careers or the programs that the students can adopt even if they don't have a medical degree. So now I would request Dr. Madhu to share the e-certificate and e-memento as a token of appreciation to our speaker.
Thank you very much. That's so very kind of you. Thank you very much.
So we will mail this to you.
Thank you.
Okay. Now I would request Dr. Parul Singh for a formal vote of thanks.
Thank you, Dr. Leena. A very good morning to one and all present here. It gives me an immense pleasure to present a formal vote of thanks on the behalf of Vidhya Vistar scheme of Deshbandhu College. First of all, my deepest gratitude to Dr. Samiksha Singh for such a useful and elaborative talk on various aspects of public health. It's a very important area in the present scenario. Thank you very much, ma'am, for sparing time for the students of Deshbandhu College as well as for Pettigrew College. And I'm quite confident that the students have greatly benefited and motivated from this webinar to join the public health area. I remain most grateful to Principal Deshbandhu College, Professor Rajiv Agrawal, for great encouragement and support always. Thanks is due to Dr. S.A.S. Suraishan, Principal Manipur College. Further, I am thankful to Vice Principal Professor Kamal Kumar Gupta, IQAC Coordinator Dr. Aditya Saxena for their support wherever needed. I appreciate faculty members of Deshbandhu College, Pettigrew College and other institutes for being here today. And our students are the key of success of any event. So thank you very much to all of them to listen the talk very carefully. And last but not the least, I am highly thankful to Dr. Monica and her team for the technical support throughout the program. Thank you each and everyone. Over to you, Dr. Madhu.
Thank you so much, ma'am. I humbly request all the participants to fill the feedback form. The link for the same will be shared in the chat box, and it will be shared again and again. Now we are coming to the end of this event. We are looking forward for your participation in all the forthcoming events under the flagship of Vidhya Vistar scheme. We are organizing a webinar on gender sensitivity, its roles and responsibilities on 2nd July 2022. Kindly grace this humble event with your presence. Yes, thank you, Dr. Leena, for sharing this poster. So this information will be shared in the chat box also. You are requested to share this information with your friends and the students. Now I request all the participants to switch on their camera, and we request the media team to take a screenshot to cherish the memories.
Please share the feedback with us also so that we can improve further. We from coming from the public health field sometimes feel challenged to take it in a very simple language to our students. So feedback would be very useful.
Sure, ma'am. We will share that whatever responses we will get, we'll share with you.
Thank you.
So the link for the feedback is shared in the chat box for all the participants. Once you fill this feedback form, e-certificate will be generated. So kindly fill the name as required in the certificate, as well as the name of your college or institute as you wish to be given in the certificate. It will be received via mail in your inbox. In case you do not receive the certificate within few minutes or within an hour, kindly contact us on the mail ID given in the poster, and we will look into it, and we will share the certificate with you via mail. So all the participants are requested to please fill the feedback form. We are really greatly honored by the presence of all the participants, and we wish you all happy and healthy life ahead. And I hope this event has given you a wonderful opportunity to consider public healthcare system as one of the important, you can say, nowadays career for your future. I hope that everyone has filled the feedback form. We can give one more minute.
I have given the permission to all for starting the video, so they can start their video.
Yeah, please. It's a request because we are not seeing each other physically. So at least through this virtual channel, at least we can have a visual view of everyone. We will be sharing a short report and all the screenshot, and as well as the link for this recording, which is available on the YouTube channel of Deshbandhu College. It will be shared on the website of Vidhya Vistar scheme also. So those who are not able to get it properly, they can again revise it from there. It is available in the YouTube channel of Deshbandhu College. So with this, we are at the end of this session, and hope to see you again in our next event on 2nd July.
Thank you. Thank you, Madhu ma'am.
Thank you so much, sir. Namaste to everyone, and I